Assalamu alaikum. Now I would like to discuss about B cell disorder. First of all, start with this. This is Bruton's disease or Bruton's agammaglobulinemia or X-linked agammaglobulinemia. In here there is defect in BTK gene, so there is no B cell formation, no B cell maturation, there is no B cell maturation, and we know that B cell is converted into plasma cell, and plasma cell makes antibody. As there is no B cell, uh, no plasma cell, no antibody, so there is recurrent bacterial and enteroviral infection. Recurrent bacterial and enteroviral infection. Recurrent bacterial and enteroviral infection after 6 months. There is recurrent bacterial and interval infection after 6 months. There is absent B cell, and in here there is absent thymic shadow. Can you tell me other two cause where there is absent thymic shadow? Yes, one is DJOR syndrome and other is SCID. In these two diseases there is absent thymic shadow, and now another disease called Bruton's disease. In here there is absent shadow, and there is absent or scanty lymph node, and tonsil, primary tonsil, and live vaccines are contraindicated. Can you tell me another place where live vaccine is contraindicated? In SCID there is live vaccine is contraindicated, and Bruton's agammaglobulinemia, in here live vaccine is contraindicated too. And that is all about Bruton's agammaglobulinemia. These are the features of Bruton's agammaglobulinemia. Okay, now this is the person showing his tongue, and this person has selective IgA deficiency. There is selective IgA deficiency, and the cause you can remember by a mnemonic that it may be asymptomatic. There is asymptomatic, there is ARA and GI infection, there is ARA and GI infection, there is ARA and GI infection, there is autoimmune, there is autoimmune, there is atopy, there is autoimmune, there is atopy, and there is anaphylaxis to IgA containing products, and there is anaphylaxis to IgA containing product, anaphylaxis to IgA containing product. And this is all about selective IgA deficiency. In selective IgA deficiency, the features you can remember by it may be asymptomatic, there may be RA obstruction, and there may be RA obstruction, there is IgA deficiency, there may be autoimmune, there may be atopic, and in selective IgA deficiency there is decreased IgA with normal IgG. There is decreased IgA with normal IgG and IgM level susceptibility to Giardia infection. There is susceptibility of Giardia infection and sometimes interviral infection. And another thing you have to remember that if a person have anaphylaxis following blood transfusion, at that time, if the person has a history of anaphylaxis during blood transfusion for multiple times, then you have to figure it out that he might have selected IgA deficiency. And the last disease, this is the person who have CVID, severe common variable immunodeficiency disease. Common variable immunodeficiency disease. In here, it usually affects after 2 years. Can you tell me a disease which affects after 6 months? Yes, X-linked Bruton agammaglobulinemia usually happens after 6 months, and in there is BTK gene problem. And now in CVID there is usually presence after 2, maybe considerably delayed, and increased risk of autoimmune disease, bronchiectasis, lymphoma. increased risk of autoimmune disease, bronchitis, lymphoma, and other cytopulmonary infection. And there is decreased plasma cell and decreased immunoglobulin. There is decreased plasma cell and decreased immunoglobulin. That's all for today. Inshallah, you will be benefited.